Hello parents, this is Dana. I'm going to touch on physio, physical or occupational therapy today, PT or OT. It is common for kids on the spectrum to have low tone muscle. Therefore, there could be delay in both gross and fine motor skill as compared to their peers. After getting a diagnosis, parents are usually recommended to engage either OT or PT intervention for the child besides other forms of interventions. Child on the spectrum with sensory integration and overloading issues would benefit from seeking help from a PT or an OT. The specialty of PT and OT are that they are able to conduct listening therapy if they are trained and licensed, which other forms of intervention might not cover this area. There are a few different types of listening therapy that we can choose, and before you decide on which one it is suitable for your child, you can find out more in detail on why the OT or PT recommend what they recommend. It is important that the recommendation is going to help to pinpoint the issues that your child displays and you like your child to overcome. The more common different types of listening therapies available are tomatis, ILT, integrated listening therapy, and Samonas. Tomatis and ILT are more commonly used by OT, and most OT and some therapeutic listening center will conduct them. Tomatis apparently also offer some adult programs. Samonas is less available as I am aware, and I have used this intervention together with my pediatric PT who is trained and licensed to conduct Samonas. Samona uses a multi-sensory approach which combines sound with movement to stimulate the vestibular and auditory systems of the child simultaneously. This integrated method provides a unique approach to sensory processing, emotional regulation, and cognitive skill development. And this actually pinpoints to the areas that my child needs to overcome. From here, there would also be speech enhancement, and the child would be able to follow instruction better. Socially, there would be a decrease of social arousal related to sudden outbursts, which is quite common among kids on the spectrum. This is sensory overloading issues, which I always bring up in my previous videos. My child is a very sensory child when he was young, and Samonas seems to pinpoint on his needs during his early intervention stage. Later on, we actually move on to ILT, integrated listening therapy. Even though ILT and tomatis would bring about similar results as Samonas, but I believe the intensity of the music is probably different. Parents can look into this and check with their OT or PT if you are interested to explore this form of intervention for your child. A positive mindset leads to a positive future. This is Dana from danalim.com. Please subscribe to my channel and press the subscribe bell for the latest videos.